Sleep disordered breathing, or commonly known as obstructive sleep apnea, is a fairly common, debilitating, and sometimes life-threatening condition that afflicts a fairly significant fraction of the U.S. population. The term apnea refers to the cessation or the slowing of breathing for 10 seconds or more, and is frequently noted or noticed by the bed partner as gasping or choking the patient.
My wife would say, sometimes I think you're dying, you know, and I'd ask her why, and she'd say, because you'd be breathing real heavy and then all of a sudden you would just stop.
As this airway space narrows, and the most common reason is during sleep, the individual loses muscle tone. When that patient loses muscle tone, the tongue falls back in the airway. The procedure that I commonly perform, and that was performed on Mr. New, is what is referred to as the tongue and hyoid suspension. The tongue and hyoid suspension utilizes a device that inserts screws in the inner surface of the mandible. These screws have attached to it a very strong suture called proline, and that suture is placed around the hyoid bone. The hyoid bone is attached to the lower base of the tongue. This brings the hyoid bone closer to the mandible, opening up the posterior airway space. In addition, there's another suture that's passed within the tongue, and that holds the upper base of the tongue.
Now it's just, you wake up, you're just refreshed because you have, gotten sleep. I noticed after my surgery, I fish a lot. When I got on a boat, the wind would go through my nose and would just be going down the back of my throat because now that passage is open. And it was just a totally different feel than you ever felt. There was lots of times when I would fish before that I'd be like, I'm just too tired to go. I don't want to mess with it up. Now it's not like that. It's like, if I got a chance, I'm going, even if it's just for a little while.